Welcome everybody. Good afternoon to our East Coast attendees and good morning to our West Coast participants. Thank you for joining us today. My name is Monica Vaz and I will be your facilitator for today's presentation. This event has been sponsored and organized by Zwell.ca. Zwell is your trusted source for health-related information and highest quality natural health products and supplements. You can shop at your convenience from the comfort of your home or office at Zwell.ca. Your order is discreetly packaged and shipped to your home or office, so relax and enjoy shopping at Zwell. We would like to start today by covering a few housekeeping items. We have scheduled a 15-minute Q&A period at the end of today's presentation. So if you have any questions, post it during the course of the presentation in the question box on your webinar panel to the right of your screen, and our presenters will try their best to answer them. A short survey will pop up at the end of the webinar. There are just 3 questions, so if you can please take the time to answer them, we'd really appreciate your feedback. Okay, so let's get to it and start this presentation today. Our host for today is Chia Chia Sun. Some of you may have seen her on Dragon's Den. She is the creator and formulator behind Mae by Damiva. Welcome, Chia Chia.
Thank you so much, Monica, and thank you to everyone for attending. As Monica mentioned, I'm the CEO of Damiva, Inc., and we are a women's health company developing natural products for peri- and postmenopausal women. And I just thought I'd share a bit of how Mae by Damiva was created. As Monica mentioned, essentially, Mae by Damiva was a kind of a mission of mine based on the fact that when I was researching hormonal cancers, which is my job, I used to be a pharmaceutical executive, I was shocked to find out that the vaginal dryness associated with hormonal cancers is not transient. In many women, it's permanent. And then I started digging deeper into the literature and discovered that the majority of menopausal women have vaginal dryness and leading to vaginal atrophy, which is essentially membrane dryness that leads to shortening of the vagina. And I was amazed. I'm perimenopausal myself, and I started looking at products and thinking about what I would use for the next 30 years. And I couldn't find a product, neither prescription nor over-the-counter, that was entirely natural. And so that led to the formulation of Mae, which is entirely natural. It does not contain water, parabens, alcohols, or anything that would further dehydrate the vaginal membrane over time. And what I thought I would share with you is some of my learning about menopause. My background, as I mentioned, is actually cancer drug development. And so essentially, the menopause, was not an area that I was trained in, so what have I learned? Well, what was probably the biggest surprise to me is that there is no standard of care for vaginal atrophy or atrophic vaginitis. We now have, in the history of the world, the largest menopausal population ever, without that many treatment alternatives when it comes to vaginal dryness. And there have been many issues that have potentially, interfered essentially with the development of solutions for women. I think a large one is the lack of diagnosis. So essentially women self-report symptoms to doctors. Doctors are not letting women know when they do a standard gynecologic exam that they have vaginal atrophy. And vaginal atrophy will essentially affect most women before and after menopause. And because there's no standard of care or diagnosis, the treatment is therefore highly variable and highly dependent on the woman. And there's a great Medscape webinar here if you want to look it up, in which 3 doctors talk about the social taboos in terms of how to treat vaginal atrophy. Next slide, please. So where does vaginal atrophy fit within the spectrum of menopause? So I just thought I'd give you a Menopause 101 overview. Perimenopause essentially refers to the 10 years before menopause. So typically it starts at age 40 in most women. Menopause, as you may know, is the cessation of menstruation for 12 months. Vaginal dryness can occur throughout the course of your life. However, it does start in perimenopause and then continues. The vaginal pH increases dramatically within 12 months after the cessation of menstruation, from a pH of 3.5 to 4.5. And that leads to a change in the vaginal milieu and the bacterial environment. Women have a much higher incidence of infection, odor, and incontinence due to the changing bacterial flora. Yeast actually goes down, but new bacteria come in, E. coli, Gardnerella vaginalis. Women also start to experience pain with intercourse, which is also called vaginismus, and other issues such as facial hair growth, hair thinning, and halitosis, which is bad breath. Then what happens over time is that the vaginal dryness leads to atrophy and extreme friability or sensitivity, which can often lead to bleeding of the vaginal membrane. And so Lisa Leger, a natural health expert, she will, after me, focus on how to treat many of these issues naturally. And what there is generally a consensus on is that there is no standard of care when it comes to treatment. The medical profession proposes first line that you try moisturizers and lubricants first, and then if you really need hormone replacement therapy, then we can try systemic and localized vaginal hormone replacement therapy. And so it's very interesting that if you look though at that at the treatment paradigm, there is nothing that is standardized for women. And that's really what led to the formulation of Mae. Next slide, please. Lisa will talk about Mae in some detail, but just a few highlights. Mae comes in these ovules or suppositories that are inserted every 1 to 3 days, depending on the woman. And really, I consider it long-term natural lubrication. As you can see here, the 4 typical treatment regimes, traditional lubricants such as KY jelly, there are moisturizers such as Replens, hormonal vaginal creams such as Vagifem, and then made by Damiva is the new kid on the block. And we do believe that this new vaginal lubricant is quite unique, and the reason being is that it offers a long-term solution and can be used as both a lubricant and a moisturizer, and does not have any chemicals and does not have hormones. Many pharmacists have and physicians have recommended Mae in combination with a hormonal cream. And so that concludes my part of the presentation, and I will turn the microphone over to Lisa Leger, who is a women's health and natural medicine expert, and she will give you an awesome overview of vaginal dryness, as well as natural remedies and how to manage your own vaginal health over the long term.
Well, thank you, Chia Chia. Hello, everybody, and thanks for joining us on the call today. My name's Lisa Leger. I'm a women's health educator with Justice Health Works for Women, and I work in an integrated pharmacy where we blend the best of both worlds, the natural and conventional medicine approaches. So I'm really pleased to be on this call today with Chia Chia Sun. She was on the Dragon's Den. She did receive 3 investment offers. Those smart dragons recognize there's a demand for a product that's free of hormones and chemicals, and we're going to tell you more about Mae, as well as some of the other diet and lifestyle natural approaches. So we're not going to be squeamish. We're not going to use euphemisms for the lady parts. We think there's probably way too much of that in our culture already, and exploring the issues around it would be a whole university course. So I just want to quickly acknowledge, obviously really important to us. So we know that you're busy and you're attending this call because you hope to be educated and get some information. So let's just start with a quick anatomy lesson and keep things practical. We are talking about vaginal dryness today. We're not talking about arousal fluid. We're talking about the actual tissues of the vagina itself. Arousal fluid is produced with stimulation and with arousal, regardless of age or hormone conditions, by the Bartholin's glands, which you see here situated kind of on the back of the vaginal opening. This is why you'll notice more arousal fluid down in that area instead of up around the clitoris. Today we're mainly talking about hydration of the tissues within the vagina in the context of just plain old good health, as well as for comfortable enjoyment of intercourse. You can certainly use personal lubricants or saliva during sex, but sometimes the tissues themselves become fragile, and that's what Chia Chia was talking about, and that's why sex can become uncomfortable for women, and sometimes their partners notice as well. And speaking about the clitoris, let's all just make sure we know what we're talking about here. You should know that it's not just that little button everybody jokes about, but there's actually erectile tissue similar to what's inside the shaft of the man's penis. And that erectile tissue extends down from that little roll of meat under the hood there and deep inside and around the vaginal opening. So we ladies get erections just like men do, but ours are inside and so not as noticeable. Here's a side view to give you the idea where all that erectile tissues that of course are needing attention as well. And I just want to add quickly that the use it or lose it principle is really important here. It's best if all these erectile tissues, muscles, ligaments, skin, mucous membranes, all the tissues of our sexual organs are healthy and strong for optimal sexual functioning. So practice, ladies, even if you're between partners. I've talked to women who've been celibate for many years and then found sex painful and difficult when they get back into a relationship. So I do recommend masturbation, as does Betty Dodson, to keep the tissues primed. Chia Chia mentioned the difficulties that some women and their doctors have even discussing sexual matters, and the fact that us baby boomers are not going to suffer in silence. We want to enjoy our retirement years, and we won't stand for any brush-offs like, oh, that's just part of aging type of thing. We want solutions, and Mae is definitely one of the better ones that I've found for vaginal dryness. These statistics tell us that vaginal dryness is prevalent, and pain during intercourse is not unusual in the menopausal population. So no, we're not alone with this problem, and that's why Chia Chia wants to solve it. Here are a few comments about the personal care industry. There's all sorts of products for men, and all we women get is hormones. So they're working on a pink Viagra for women, but we women know that there's different factors involved in arousal and enjoyment of sex. We need to feel safe, we need the conditions to be right, and so on. So for us, it's not just about having an erection. We need more than that to enjoy sex. And that's why that quest for the pink Viagra pill may never really end, until some of those other factors are addressed. And let's move on quickly to address some of the myths about aging that tell us we should either accept becoming old crones and survive, or we should maybe strive to be the goddesses that we were in our 20s. Both are unrealistic. Obviously, there's many individual differences in sexual interest and desire and so on. And, we're going to address some of those factors today. As I mentioned, our culture is quick to chalk everything up to simplistic explanations like hormones. And sure, we know that hormones do play a role. It's true that vaginal dryness is common in certain hormonal pictures are present. So the postmenopausal vaginal dryness obviously is associated with lower estrogen levels. We also see vaginal dryness during pregnancy and breastfeeding, and in women that are on hormonal birth control, because the hormone picture is similar. So we really aren't just targeting the perimenopausal women and postmenopausal women with Mae. Some younger women may need Mae as well. I talked about some of the many factors that can be involved in women's experience of sex: body image, relationship issues, comfort levels. These are really big factors. I just want to emphasize scar tissue from cesareans, hysterectomy, episiotomies, tubal ligations. These things can form adhesions that can also cause pain and discomfort with intercourse. If you think that scar tissue from surgeries might be a problem, then do find a good physiotherapist or massage therapist who's had extra training in what's called visceral manipulation. These are treatments that break down some of those adhesions, put the bladder back in place, and so on. And this can be really, really helpful if there's, actual structural issues going on as well. And keep in mind, you can have more than one thing going on at once. A lot of people aren't aware that certain antidepressant drugs and pain medications can also flatten libido or contribute to deterioration of the vaginal mucosa. Chia Chia has worked with an oncologist who was really troubled knowing that the chemo drugs and anti-estrogen drugs that she gave her patients were causing vaginal dryness. And this doctor was really relieved that she can now recommend Mae to those patients to mitigate the side effects of the prescriptions that she's writing for her patients. So estrogen was identified as the female hormone and given attributes of supplying us with feminine traits, those things like our curviness and our dewy skin and so on. We now know that a lot of that was marketing hype. Research has found little difference between the skin of women on hormone replacement compared to the skin of those who weren't taking it. Of course, topical estrogen does have a role, and in some cases, it's indicated. So we'll talk about that further later on. The problem arose when we assumed that synthetic estrogen would provide the same benefits that our very own estrogen that our bodies produce. This assumption has been shown to be tragically incorrect. And a whole generation of women have been the guinea pigs in what one of my heroes, Barbara Seaman, called the greatest experiment ever performed on women. She was the author of The Doctor's Case Against the Pill way back in the 60s and 70s, and her colleagues, including Gloria Steinman and Ms. Magazine publishers and Our Bodies Ourselves editors, were really instrumental in getting warning labels on prescription products. So that sheet that you get with your prescription that tells you about the side effects, that's because of them. So thank you very much, Barbara Seaman. Don't get me started on all the damage to women's health that I've witnessed as a fertility educator. I'm critical of hormonal contraceptives like the pill, the shot, the implant, because synthetic estrogen is a known carcinogen. We're giving it to perfectly healthy women, not to treat a medical condition, but to purposely disrupt their endocrine system on purpose. It seems awfully extreme when there are so many other ways to avoid pregnancy. And with my fertility education practice, that's what I do. I teach a natural approach to birth control so that my clients don't need to take hormones. One of my colleagues, Jerry Lynn Pryor, is an endocrinologist at the University of British Columbia. She took estrogen levels from women at various ages and stages of life, and she found that in the perimenopausal years, estrogen levels can actually get quite high. So the ovaries are fatiguing and the brain is still trying to get the ovaries to ovulate. And so ovulation can be delayed, so your periods get further apart, closer together, further apart. This can actually generate quite a lot of estrogen. So here's a picture of what she found when she actually took estrogen levels in women. And she's been able to show that progesterone levels actually drop much sooner than estrogen declines in aging women. So this sort of pokes holes in the conventional wisdom about menopause, and it certainly is far more complex than we've been led to believe. Not only do we have our very own estrogen that our body makes, sometimes there are estrogen-like chemicals in the environment that we're also exposed to, compounds that, depending on our diet and lifestyle, can be more of a factor. And, I could go on and on about cancer risk with estrogenic types of environmental exposures, but I'm sure that our listeners today are up on that subject, and it certainly does come up in the issues of breast cancer incidence in areas where there's high amounts of pollution. Bleaches and so forth have been shown repeatedly to contribute to cancer risk. So we want our estrogen because it does good things to us, protects our bone density and so on, but we don't want so many estrogen-like chemicals in our body that it's causing trouble for us. And naturopathic doctors, of course, are very concerned about this issue. They know that a lot of gynecological conditions that women present with are actually related to excess estrogen levels. When they treat PMS, perimenopause, fibroids, certain abnormal bleeding conditions like heavy menstrual bleeding with lots of clottiness and so on, they actually go straight for the liver. They want to treat the liver and intestine because they know that those organs help to eliminate excessive hormones from our system, and they want to make sure that those channels of elimination are open so that things function properly. Around with our hormone levels, let's just look at things that are not hormonal. The whole idea of giving hormonal drugs to solve our problems is really quite passé. We're in an era now where doctors who don't know what to recommend. They went to med school and they were told to prescribe, and since the Women's Health Initiative study, we realized, yeah, maybe we should back off on that because there were more, risk than benefit to hormone taken throughout the whole system. Women are therefore kind of left to fend for themselves, though, these days. So we're going to talk about non-hormonal solutions to vaginal dryness and natural ways to keep the vagina healthy. Hydration, this is a big topic, and also, calming down irritation and targeting the tissues themselves rather than expecting the hormones to do all the work for us. So I'm sure you're all familiar with the concepts of natural medicine. I'm trained in complementary medicine, and I base my fertility education practice on these principles. I'm sure you can all relate to this. So the notion that treatment should not harm the patient. I think I've made that point fairly clear where I stand on synthetic hormones. They are known to be carcinogenic, so why are we putting them in perfectly healthy people's bodies? The idea that the body is a whole system and can have many factors at play. We look at the whole person, not just their hormone levels. And importantly, I'm sure that there's a lot of healthy living types on this call today, and you do understand the value of eating whole food and using whole remedies as much as possible. So quickly on nutrition, I'm assuming that we've got a well-educated crowd on the phone here today. So just to sort of review, magnesium, vitamin D, these things are important for mood and PMS, blood sugar levels. They can contribute to, water retention, swelling, cravings. We can all do better with our diet and lifestyle. When you feel uncomfortable, when you have symptoms, that's an invitation. Your body is giving you a message that you can make improvements. You can eat healthier, get more exercise, take up some yoga, breathing practice, get some sleep already. So I just, want to invite you to kind of tune in and nurture yourself. You look after so many other people. You got kids, parents, a household to run, and all these things. You really do have to take time to look after yourself as well. Specifically with relation to hydration of the tissues, especially the delicate mucous membranes of the vagina and vulva, we need good quality fats and oils. So please do not be fat phobic. Cold pressed nut and seed oils, they are heart healthy, they help us with slimming, they do not make you fat, and they won't raise your cholesterol levels. In fact, they raise your good cholesterol, which helps to clean up some of the dangerous cholesterol in the body. So the more the better. Olive oil, flaxseed oil, fish oil, hemp seed oil, nut and seed oils, all that stuff is good. I mentioned that if you go to see a naturopathic physician about any kind of gynae problems, they'll often want to do a liver detox and intestinal cleansing. This is because they know the liver filters the blood and discards the hormones that can be, sometimes they can actually be reabsorbed at the intestine level too. So we want to make sure that these organs are working properly so the body can actually remove excess hormones before they cause trouble. They also sometimes prescribe adrenal support formulas, B vitamins, and certain herbs that can kind of help to nourish and support the adrenal glands. And as I said, us frazzled middle-aged types can often use some adrenal support in our, because we've had a lot of years of running hard and trying to juggle all those balls. So naturopaths recognize that, and they do really want to support the adrenal glands. They want to make sure your thyroid is functioning properly and those sorts of things, rather than just zeroing in on that pesky hormone level that might be too high or too low. They'll also tend to recommend topical fixes like personal lubricants rather than hormone replacement. When you're thinking about personal lubricants, please avoid all that glow-in-the-dark, flavored, scented stuff that's out there on the market. Opt for products that have as few ingredients as possible. You might have seen those heating up lubes that they have on the market these days. They use menthol, which can be really effective. It's been shown to stimulate the production of arousal fluid from those Bartholin's glands I showed you at the beginning. But the menthol could be irritating for some, so I suggest that you experiment a bit, maybe do a little patch test before going wild with those mentholated types of products that heat up. Now let's talk about Mae. It's a suppository, as Chia Chia said, that you insert into your vagina every 2 or 3 days, or you can do it daily if you want to. My colleague tried it every day, and she was really impressed within the week. She said she felt like a teenager again, just as Mae's website says. So just like you put moisturizer on your face, how many of you put cream on your face this morning? So think about moisturizing your vagina as well. Mae was named after Mae West, who you might have heard of. She was a Hollywood starlet in the early days of film. She was famous for saying, "Why don't you come up and see me sometime?" Did you know she was actually arrested for doing a play titled Sex? I wonder if Madonna knows about this. So here are the ingredients in Mae. Cocoa butter and cocoa butter have been used in skincare products forever. In products like Preparation H, for example. Vitamin E is studied and proven to promote healthier vaginal tissues. And I will go into more detail on the other ingredients right now. But first, let's talk about what's not in Mae. There's no water, alcohol, preservatives, chemicals of any kind, no waxes, no gluten, and of course Mae is not tested on animals. One of the ingredients, hyaluronic acid, is really interesting. They put this stuff in wrinkle creams because it attracts more water into the cells to make them plump up and be better hydrated and more flexible. Orthopedic surgeons actually inject hyaluronic acid right into people's dry arthritic joints to give them viscosity, to hydrate the cartilage tissues. This slide is reporting on a clinical study where it was shown that 99% of the women who were given hyaluronic acid reported optimal or good effectiveness. They had less burning, itching, and pain. There's also clinical evidence that a gel made with sucrose was just as effective as an antifungal cream for bacterial vaginosis. This is because the sucrose feeds the good bacteria, which then make things difficult for the bad bacteria that are causing the itching, odor, and irritation. So that's why there's sucrose in there. There's been research on the use of sea buckthorn oil to treat cervicitis, which is inflammation of the cervix. They applied the oil directly to the cervix along with some Chinese herbs and got very good results in reducing inflammation and pain and restoring the tissues. Sea buckthorn bushes grow wild in China and Russia, and they've been brought to the Okanagan region of British Columbia. It's well known in traditional cultures to be good for the skin in general, and specifically skin conditions of dryness as well as eczema and psoriasis. We know that vaginal infections and discomforts drive a lot of women into their doctor's offices. Let me talk about the natural approach to the healthy vagina. I talked about this a bit earlier when reviewing some of the ingredients in Mae. We have a pH correcting effect, which supports the good bacteria, and the sucrose, which supports the good bacteria as well. These good guys then keep control of yeast and bacteria that would otherwise gain the upper hand and cause problems. To go into it in a bit more detail, the vaginal environment is supposed to be an acid pH. This helps to kill bacteria, yeast, and sperm that would get into the vaginal environment. If the environment is allowed to creep up toward the alkaline range, then it will be more hospitable to these things, and that'll further break down in the situation will occur. If the vaginal walls can't produce food for the good bacteria because of the declining estrogen levels, then they can provide the sucrose to feed the good bacteria so they can keep the environment balanced. Some people simply do not have enough of these good bacteria. Perhaps they've been on antibiotic use, of course, which kills some of the good bacteria along with the infection. There's a lot of other things that can kind of disrupt that environment. Douching, use of products that would change the pH in there and this sort of thing. The good bacteria is supposed to live in our intestines and all throughout our digestive tract as well as inside the vagina and on our skin. You see all those yogurt commercials on TV, everybody's dancing around, they got the happy tummy because they ate their good bacteria from the yogurt, right? So that's really what I'm talking about here. Sometimes a probiotic supplement is required to get that good bacteria balanced out again. Taking it orally is great. It benefits the intestine and vagina. And sometimes a probiotic vaginal suppository is indicated when these lactobacilli are depleted. Oral use can be adequate, but sometimes we need to put those good bacteria right back into the vagina. I just want to say no to douching. The vagina is like a self-cleaning oven. You should never have to douche, and I have seen women damaged with pelvic inflammatory disease, scar tissue in the fallopian tubes, and so on from excessive douching. This whole notion stems from fear of the unclean, which is really unfounded, and squeamishness about the female body, which really is insulting. There's nothing inherently icky about the vagina, and we don't need to smell like flowers or rain or whatever. Okay, enough said on that. To conclude, we need good food, always good quality fats and oils, proper sleep, exercise, and often some supplements or topical treatments to prevent or treat vaginal dryness. I talked about the use it or lose it concept. We really want to emphasize that if you're going to resort to hormones, try other things first. So as Chia Chia mentioned, Mae is used every 2 or 3 days, regardless of whether you have a date for sex or not. It's meant to act as a personal lubricant, although, you can use it before sex if you want to. Experiment, see if that'll work for you. It might work really well. But really, it's meant to be a moisturizer or hydrator, so that when you do have sex, you're more comfortable, the tissues are more hardy and less fragile. I encourage you to use lubricants during sex as required. There's some nice natural lubricants. I'm partial to silk, but there's many others. I just want to leave you with a final warning. If you're still feeling fed up and considering estrogen replacement, do opt for the topical estrogen over the tablets to avoid the very problematic side effects. I'd encourage you to try Mae. You can feel better quickly, and the long-term use will definitely promote repair of the irritated tissues. Mae makes the tissues of the vagina more hardy, less fragile, makes it better to enjoy sex, and you'll be less likely to be prone to bladder, yeast infections, bacterial infections, that sort of stuff. We've had really tremendous feedback. There's a lot of excitement about Mae because women are demanding a product like this that's free of hormones and chemicals. We're going to open it up now for questions, and thank you for your time. We'd love to hear from you if you decide to try Mae. Visit us at bydamiva.com and tell us about your experience with Mae.
Thank you, Lisa, for your insightful and informative presentation. The forbidden words of menopause is vaginal dryness, so we hope today's webinar helped to get this conversation started. We have received a few questions from our participants, but before we get to them, we'd like to share with you an offer from Zwell. Our first offer is you can buy 3 boxes of Mae by Damiva for the price of 2. And the second offer, we created a special health bundle. As Lisa mentioned, a good probiotic supplement will support overall vaginal health. And for that, we recommend Innovite Health's Feminine Support Probiotic. So with this offer, we have combined 2 boxes of Mae and 1 bottle of Innovite Health's Feminine Support Probiotic. So you can buy these online or call Zwell's toll-free number, and a customer care agent will be happy to help you. So let's get to the questions now. The first question we received is Mae for use only just before sex, or is it to be used every day, or you use it regardless of sexual activity? Chia Chia, Lisa, who would be best to answer this?
Well, I can answer that, or Chia Chia might want to.
I think Lisa, you already did, but it'd be great if you could repeat, sort of what you said, and then I can provide my perspective on it too.
Right. So Mae is meant as a hydrating or moisturizing topical treatment that a woman would use regardless of whether she's having sex or not, just on a regular basis, just like putting lotion on your skin or moisturizer on your face. Some people have found that they like to use it before they're going to have sex. It's a suppository, so it needs to melt and absorb into the tissues. I don't have experience with people using it as a sexual lubricant so much, but I think Chia Chia may, so you might want to address that a little bit more.
Yes, Lisa, so some of the feedback that I've had, and I think it's very personal because just like managing our health is very personal, managing our vaginal health, will really differ from woman to woman. And so some of the feedback that I've had from Mae as a sort of a traditional lubricant, in other words, as a replacement for KY jelly, is that it does help with post-intercourse discomfort. And so I do have feedback from women who use it in advance of intercourse. It does take a few minutes to melt, so it, and that also depends on the women. Some women it may take longer to melt. So I think it's Mae's fairly unique that way, in the sense that it's really meant to be sort of an individualized solution depending on what your needs are. I know many women who are using it, as Lisa said, almost daily, although as I think over time they start to decrease their need for it. Maybe it's strengthening the tissues. I don't know exactly why. But I also know many women who are just using it in advance of intercourse. And then there's another group of women who use it for both.
Okay, great. Thank you both for that answer. We have another question here, and this one's about, the person really likes the session, very informative. And the question is, when might younger women pre-perimenopausal years have to cope with vaginal dryness? Lisa?
Oh, yeah. Well, I mentioned a few examples: pregnancy, breastfeeding, and being on hormonal birth control, being on the pill. So those are common situations where younger women may end up with vaginal dryness problems similar to those that a postmenopausal woman might be running into. So certainly Mae is indicated for any age. It's not exclusive for a postmenopausal use or anything like that. And a younger woman may go through a stage in her life. I've got many clients, breastfeeding women who complain of vaginal dryness. They could be in their 20s and 30s, and it's just a function of what's going on hormonally because of their postpartum or breastfeeding situation.
Okay.
I've also run into women with vaginismus who they actually have pain with intercourse, and I recommend Mae to them as well, even if they're not breastfeeding or on the pill.
Okay, great. Thank you for your answer. Sorry, go ahead, Chia Chia.
I just might mention the sort of the perimenopausal years, and they can really differ from woman to woman. So if a woman age of onset of menopause is 45, it can start as young as 35. In other words, the 10 years leading up to menopause. And as Lisa mentioned, the estrogen levels really cycle up and down. And part of my reason for formulating Mae is to promote vaginal health before menopause, so that when menopause hits, and it hits fairly drastically, because you're going from decades of having estrogen to within 12 months, your adolescent, prepubescent years, so that when it hits, you're already sort of in the groove of thinking about your vaginal health and how to optimize your vaginal environment for in preparation for menopause.
Okay.
Mm-hmm. Being proactive.
Mm-hmm.
Thank you both.
I mean, we put moisturizer and sunscreen on very proactively, but I don't think we've been trained to think about vaginal health proactively that way. And and we all know now, or and many of us are learning that after menopause, this is a key area.
I didn't realize it was as prevalent as it is until I started working with Chia Chia.
Yeah, I didn't realize it either until that the statistics are actually that 40% of women have pain with intercourse. But I met recently with Dr. Elaine Jolly, who's the president of the Canadian Menopause Society, and she basically said this is ubiquitous, and every woman at some point will have this problem. Over time, it might be when you're 40, 50, 70, it will happen, and that she had just gotten back from the International Society of Menopause meeting in Cancun, and the number one presentation was on using lidocaine to treat vaginal pain with intercourse. And I just thought, we've got to be beyond using lidocaine, in the vagina.
Lidocaine, that's like a numbing agent. It just numbs it out.
Exactly, and and you can imagine,
That doesn't sound like very much fun at all.
Well, and after the numbing effect is over, you've likely got to cope with some tissue damage.
Right. Oh, yuck.
Okay, great. Thank you both for that answer. I have another question here, and this question is there a pH test strip for the vagina?
That's an interesting question. We do have pH paper, and you could test vaginal secretions with it. We test saliva or urine with it, so I can't see any reason why not. But it's just, I mean, there's so many nooks and crannies in the vagina, and the secretions themselves that you'd be able to kind of get with your finger, they may be unto themselves. They may not give us information about what's going on in the general environment. So it might not be that accurate or useful to be checking that way. There's probably other ways to do it, though.
Okay. Okay, thank you. Another question is the sugar in the product contraindicated for a woman that has sugar-restricted diet due to breast cancer?
The sugar is topical, so it's not absorbed systemically. So, and it's very, very tiny amounts, of sugar. So, I think it's a great question. You might want to speak to your physician about that. But just in terms of the formulation, there's not much of it, and it's encased in these butters, these natural butters, that basically coat the vagina. So it's not likely that they would get absorbed very quickly, and certainly it's not oral, it's not systemic, going into your circulatory system.
Great. Okay, thank you. And another question we have is, what is the shelf life for Mae?
2 years.
Okay. Okay, great. Another question from, this is, what causes kidney infection after sexual intercourse?
Want me to take that one? Okay,
Sure.
This is Lisa. Kidney infection is sometimes an advanced complication from a bladder or urinary tract infection. Those can be caused by intercourse in some cases. They have a condition they call honeymoon cystitis. The idea is that the urethra would be kind of irritated by a lot of rubbing and action, so there'd be a little bit of trauma, and then of course inflammation, bacteria growth, and so forth. So then sometimes sex can sort of provoke or irritate things in the bladder and urinary tract, and then of course if the bacteria were allowed to progress, then a kidney infection would be the worst stage of that progression. It does. Usually a woman would have symptoms before it could progress to a kidney infection. She would have pain with intercourse, like a burning sensation when she tries to go pee and that sort of stuff. So she would be well warned that something was up way before her kidneys got into trouble. And usually women get in and get treated before there's any harm done to the kidneys. It does happen occasionally, but it's not just an straight A to B kind of a progression.
Okay, great, thank you. Another question, would PCOS and other hormonal imbalances also contribute to vaginal dryness?
Oh, that's a great question. Yes, indeed. There's a lot of hormonal situations that can have an impact on estrogen levels, like having too much of this or not enough of that, and low thyroid can be a factor, and so forth. So yeah, polycystic ovarian syndrome, PCOS, can certainly cause havoc in the hormone levels and certainly could contribute to the types of problems that we see in the postmenopause.
Okay. Next question. Sorry about this weird question, the person writes, but how can a woman tell that vaginal dryness is becoming an issue? It sounds painful. Does it start with some kind of tight, uncomfortable feeling the way it does with skin?
Do you want to jump in, Chia Chia?
Sure. Definitely, I think probably the most common, presentation in terms of symptoms is irritation with intercourse, pain with intercourse. Many women also experience, without intercourse, just itching, burning, and a general dryness feeling. Probably the best way to think about it is that, your oral mucous membrane is very similar to your vaginal membrane. It's basically one long tube, going from your mouth to your gut, to your vagina. And the same feelings you get in terms of dryness of mouth, are I think, comparable when it comes to vaginal dryness. And it will differ, from woman to woman.
Okay, great. Thank you. One more question. Would Mae help with balancing bacteria that causes urinary problems?
Yes, yes it would. I talked about the probiotics in a fair bit of detail. The good bacteria that keeps the vaginal environment healthy, that proper environment. David Suzuki talks about the wetlands and how we need biodiversity and all that sort of stuff, and healthy populations and much diversity of species and so on. That's really, really important. So in the vaginal environment, that's also important too. And there's actually really good research, which I show to nurses and people that are skeptical. There's a study where they took women who are prone to bladder infections, split them in half, gave half a placebo, and gave half probiotic supplements orally. And those women who had the probiotics had less recurrences of their bladder infections compared to the women who were given the placebo. So this shows us that even just the oral use of probiotics can help to correct the environment in the bladder and vagina. And there's really good evidence that oral use of probiotics helps reduce yeast infections as well.
Okay, thank you, Lisa. Another question. How quickly can a woman expect relief from vaginal dryness after starting to use Mae? Does it take a few days or can it be a matter of hours? I expect the severity of the dryness factors in.
Yes, generally it does take a few applications. We recommend that women use at least a full box. If you can just think about it very kind of simply in the sense that epithelial cells take time to turn over, and in the same with the vaginal membrane. Those cells take time to turn over, and so we recommend that women try the product for about a month. In terms of immediate relief, I have had women tell me it does provide an immediate relief from itching right away. I think the best analogy is very similar to the oral mucous membrane, to the mouth. Because Mae has butters, plant butters, essentially when you eat a butter in your mouth, it just gives that sort of lubricating, hydrating feeling. And we formulated Mae, very similarly, which is to, give that lubricating, moisturizing feeling, as a lubricant. And so I think it really depends. Now, as Lisa had mentioned, she had a colleague who, tried the product intensively, every day. I think it really varies from woman to woman, but we definitely recommend that women, use the product for a month, just because it takes that long for any type of cell to turn over and renew.
Thank you, Chia Chia.
So I would say that let me just jump in there and add that I think you'd get the initial sort of feeling of creaminess and things feel nicer right away, but then over the long term you would get the actual, repair of the tissue and stuff, which is really what we're striving for. But you certainly would feel more comfortable and a little bit juicier right away when you start to use it within a couple of days. And then the long-term actual repair work would, of course, take longer, like Chia Chia says.
Okay, great. Thank you both. One last question. I've been taking over-the-counter probiotics. Does that help with dryness or vaginal atrophy?
Well, the over-the-counter probiotics help to restore the good proper environment in the tissues in general, so that you would have less risk of bacteria and yeast overgrowth, and the tissues would be less inflamed, less irritated, less, a risk of damage and so forth. So it could help to correct the pH environment and so on, but it's not really addressing the question of hydration, and that's really what the butters and the hyaluronic acid and the sea buckthorn oil and the vitamin E are doing in the Mae product. So we're actually wanting to moisturize and hydrate those tissues. Probiotics are great for helping the environment be healthy and proper and the right pH, but we really want to get those hydrating elements into those tissues, and that's what addresses the actual dryness itself.
Okay, great. Thank you, Lisa. We are done with our questions for today. We have recorded this webinar and will email it to you so you can view it again if you want, or share it with your friends and family. I'd like to take this opportunity to thank Chia Chia Sun and Lisa Leger for shedding light on this very personal and unspoken topic, and all our attendees, thank you for taking the time to participate in today's webinar. Please don't forget to complete the survey before you close your browser, and have a lovely day. Thank you all.
Thank you, Monica.
Thank you, everyone.
Bye-bye.
Yeah, thanks for tuning in, guys.